You've probably been hearing a lot about the coronavirus lately, so let's talk about what it is, what it isn't, and what you can do to help keep yourself and your school healthy and your sanity intact. Here's what you need to know. A coronavirus is a type of virus that causes respiratory tract infection. The big coronavirus in the news lately is called COVID-19, which is short for coronavirus disease 19. It's a newly discovered respiratory illness that can be spread from person to person. The symptoms include fever, shortness of breath, tiredness, cough, achiness, nasal congestion, and a sore throat. In other words, folks, this often looks and sounds a whole lot like the flu. If you get COVID-19, you may experience all, some, or potentially none of those symptoms. In fact, some people get infected and feel basically fine, but 1 out of 6 infected people do become seriously ill. The virus seems to have the greatest effect on older people and those with underlying medical conditions. It also seems less common and less severe among children. Now, it spreads through small droplets that come from the nose or mouth, like when you sneeze. It can also spread when people touch surfaces that are contaminated with droplets from an infected person. But there are things that you can do to reduce your chances of contracting it and to prevent the spread in your school and your community. For starters, wash your hands, folks, and we mean wash them well for at least 20 seconds. If you can't wash with soap and water, use an alcohol-based hand sanitizer. The World Health Organization advises that you not wear a mask if you're healthy, unless you're taking care of someone who may have COVID-19 or you have it yourself. And remember that masks are only effective in combination with frequent hand cleaning. Now, if somebody is coughing or sneezing, stay at least 3 feet away. Again, this is going to help keep you safe if the person even just has a cold. Now, if you're coughing or sneezing, stay at least 3 feet away from others and cough or sneeze into a tissue and then throw the tissue away. And of course, then wash your hands. You may also be advised to wear a mask. Try not to cough or sneeze into your elbow because your elbows go where you do. And folks, don't touch your face. We know it's hard. In 2015, a study documented on average 23 different face touches an hour. Gross. Now, what does this all mean for schools and for students? For starters, lots of schools, both colleges as well as K-12 institutions, are stepping up their cleaning regimens, wiping down objects, desks, doorknobs, and railings with disinfectant. They're also encouraging students to wash their hands, and many are extending the length of time that students with illnesses must stay home. That is all great. Prevention can sometimes be better than a cure. Now, if you of your kids have been in contact with someone who's tested positive for COVID-19, isolate yourselves, call your physician for further advice, and do all that you can to contain the virus so it doesn't spread further. Still, even with hand sanitizers sold out at stores across the country, new cases of the virus are being reported daily in a growing number of locations. We advise you to prepare, of course, for school changes and closures in your community to the greatest extent that you possibly can. Here's how. If you're at college, follow your school's guidelines. If you're feeling sick, first isolate yourself and then call the health services office for guidance on what to do next so that you can protect others as you get care. And take comfort in knowing that colleges and universities all across the nation are working hard to protect their students, faculty, and staff. The American College Health Association, which consists of campus health programs at more than 1,100 institutions, have created a task force for addressing COVID-19. In addition, dining services and campus housing teams at schools all across the country are devising plans to feed and house students in the event of a COVID-19 spread on their campus. In the past, with things like norovirus, schools moved towards serving prepackaged foods to avoid spreading illness through things like shared utensils at a salad bar. But this epidemic isn't like what we've seen before, so we've talked to folks at colleges who are working to keep their campus communities safe, healthy, housed, and fed. One of the people we reached out to is Ken Toon, Executive Director of Auxiliary Services at the glorious University of Massachusetts in Amherst. Now, UMass has been ranked #1 on our best campus food ranking list for 4 years running. Now, Ken told us that at UMass Dining, they've developed a contingency plan to stock their warehouse with necessary supplies, to work with vendors to simplify their menu items. They have not had any confirmed cases of COVID-19 on campus, but they are prepared and ready and so are thousands and thousands of schools across the country. Scary as this is, it's been heartening for us to talk to folks at schools and really appreciate how dedicated and how prepared they are. As always, we're following school changes closely and will continue to report out to you what you can expect to start seeing. In addition to making plans on campus, lots of colleges are suspending study abroad programs to affected countries and recalling students and faculty who are abroad. For international students from affected areas, especially if you're planning to travel, check with your college's International Student Services office to find out what your options are. Those teams are working incredibly hard to keep students safe and healthy. For K-12 students, the issue is less about travel and shared living spaces and more about potential school closures, which will affect both students and parents alike. As of this taping, 22 countries on 3 continents have all had school closures. Schools have closed in China, Italy, South Korea, India, Iran, Japan, France, Pakistan, and elsewhere. Now, in the United States, some schools have closed in both Washington State and New York, and Los Angeles, the second largest public school district in the country, seems poised to close schools as well. It's tough to be a parent under the best circumstances, we understand. If your elementary kids' schools close, see if you can set up a temporary homeschooling co-op with other parents where you can switch taking care of groups of kids, ideally doing some educational activities with them so that they don't experience the notorious summer slide this spring. And if your kids are teenagers, encourage them to form study groups and maybe even start a group project together. And of course, remind them to practice frequent hand washing. And for students, we're talking directly to you. If you're feeling cooped up, now is the time to let your imagination fly. Write a story, develop a new board game, create a new video game, do an art project, use your brain, and of course, keep washing your hands too. And for everyone, keep in mind that there are students who qualify for free and reduced lunch who will be affected by school closures. Reach out to your school districts and find out if there's a plan in place to get meals to folks who need them. And if there isn't, then band together with your neighbors and create one. Folks, there's not a lot of good that can come out of the spread of an illness, but if there are any silver linings, there are 3 of them. Number 1, we'll all be conscientious hand washers from now on. Number 2, when we get out of our routines, we'll use the opportunity to grow our brains and stretch our imaginations. And number 3, we'll make a commitment to support each other as a community. As we collectively work to contain this virus, we'll be monitoring how the illness and containment measures affect everyone, especially students, parents, and educators. And folks, as always, please subscribe to our channel for updates as we track this and other important topics for you. In the meantime, please do what you can to keep yourselves and your communities safe and healthy. And of course, we wish you all the best right here at the Princeton Review.